NHS North Somerset was set up in 2002 with the change of the government directive on how we were going to deliver secondary and primary healthcare. We created this lovely building that we're in now. It's called Marina Healthcare Centre and it's in Portishead. And its population covers the whole of Portishead for the GP practice, but the whole of North Somerset, which covers a huge geographical areas, and it goes from just south of Bristol to just south of Weston-super-Mare, and then across from the Channel, Bristol Channel, across to the other side of Dundry, which is close to Bristol Airport. Within the project plan, we had to look for a way of making this building more accessible, not just by foot, but also by phone. We went through a large tendering process, helped by our consortium of information technology in Bristol. And Virgin Media Business came out streets ahead of anybody else because it gave us the flexibility we're looking for, as well as the low-cost telephone access to the GP practice, which is what we decided was necessary for the patients to be able to get in touch with the GPs much more easily than they could in the past. The 0300 local number has been exceptionally useful because it means people can phone in on one number, and from that one number they have various choices. They can go through to the GP practice, they can go through to the services offered by the Primary Care Trust in the other services such as podiatry, such as physiotherapy, and also they can get in touch with the community nurses, and that goes straight through by dialing the 0300 number. They choose the community staff and it goes straight through onto their phone and their voicemail in their office themselves. And it's how we can develop that telephone system that we've now got in this building that we're looking to develop in the rest of the Primary Care Trust. In these times of emergency planning that we've been going through, and we think hard about things like swine flu, there are times when we need to move into somewhere else or move it very quickly. The 0300 number sits on what they call a cloud. So if we break down and we want to go to another building to operate from, we tell the cloud or Virgin Media Business, and they will then take our service that's offered here and put it into another building, and we don't have to worry about cabling and wiring and engineers and plugging in. It's all there, it's just moved seamlessly. The one number system that we have in this building means that every member of staff has a telephone number, and it's not a telephone number at the desk. So you can move from room to room to room but still have your own telephone number. And one of the bonuses of this is if you're running a clinic, you might be in clinic room 1 on a Tuesday and clinic room 2 on a Wednesday. But it does mean that you retain the same extension number and the same direct dial number, as all the numbers in the building are also direct dial numbers, without having to upset the balance and tell people, oh, on a Tuesday I'm on this number, on a Wednesday I'm on that number. Just give them the number and they dial that number, and it works a treat. IP Multimedia is a system that we've got from Virgin Media Business, which is a phone on a laptop with presence technology. Now, the presence technology actually gives me a screen which shows all the people that I normally contact, and in particular in this instance I want to connect up with Dr. McKinnon, and I can see that he's actually on the phone at the moment, but that doesn't prevent me from getting a message to him to ask him to call me back. And as you can see from this screen, although he's on the phone, he's been able to send me back a message which says that he'd like to get back to me in a couple of minutes because my message has said that I've got something I want him to have a look at. So what we do then is when he comes off the phone, he can then give me a ring, and we then can go on to video conferencing and we can talk about it. And what he actually now wants me to do is to send him a picture of the offending finger. I could imagine that in 12 months' time we'll see probably 30 to 40% decrease on how much we're spending on telecommunication. Every member of staff has a communication ID. They can work from wherever they are. They can work even from home. They don't have to sit at one particular desk. They can sit at any desk within the organisation. And what this means is that for the patient, they get a quicker diagnosis and a better quality service, which is what we want.